Thank you very much for having me today. It's a great pleasure, and thanks for the organizers, and thanks for the nice introduction. Um, I'm going to talk very briefly today about the relation between COVID-19 infection and diabetes, and focusing a little bit more about why are we seeing more cases of diabetes during the pandemic peaks, and how we can explain that. Um, as a start, I'm just going to briefly highlight to the audience the differences between the two major types of diabetes, which are type 1 diabetes and type 2 diabetes. Of course, there are other types of diabetes I can quickly touch on at the end. Type 1 diabetes is generally a disorder or a disease of children and young people. Having said that, we do actually see people with type 1 diabetes diagnosed late in life. I do remember seeing a 70-year-old woman who presented with a new diagnosis of diabetes a few months ago, and eventually the diagnosis was made as type 1 diabetes. How do we decide this is type 1 diabetes? Basically, the main characteristic is insulin deficiency. People with type 1 diabetes cannot make their own insulin. And this is usually happens because of autoimmunity. Autoimmunity is when the body makes antibodies that attack and cause problem with its own organs. And in this case, it's the pancreas, the organ in question. Usually, as I said, it's disease of young people, and most often people present to hospital or to doctors with a condition called ketoacidosis or ketosis. What does that mean? We need insulin for blood glucose to be metabolized in the body, but also we need insulin to, if the body doesn't get glucose as a source of energy, it starts breaking down fat. And a byproduct of that breakdown of fat is called ketones. When these accumulate in the bloodstream, the blood becomes acidic and the person becomes unwell. Why am I explaining this? Just because a bit later when I talk about COVID-19, I'm going to highlight this bit as well. Type 2 diabetes, on the other hand, is generally speaking a disease of middle-aged and older people. However, recently we are seeing more young people in late adolescent or even in young children who present with type 2 diabetes. And the problem here isn't insulin deficiency. In fact, the insulin levels are quite high. It's that the body cannot make use of this insulin because of increased body fat inside the viscera or insulin resistance. Usually it's multigenetic, which means it's not transmitted directly from father or mom to children. But if you have a family member who has type 2 diabetes, your chances of having type 2 diabetes become a bit higher. There's some other types of diabetes. For example, if someone has pancreas problem like pancreatitis, which is an inflammation of the pancreas, or if they have an operation where the pancreas is removed, or some other rare causes of genetic diabetes, these are not very common. Okay, COVID-19. Now, during the first peak of the pandemic, we noticed that the number of people coming into hospital with COVID-19, the prevalence of diabetes is higher in these people. Initially, the thought was COVID-19 is only a lung disease, but actually, eventually, we knew that it can affect many organs, including lungs, kidneys, brain, and eventually the pancreas. We noticed that we're seeing more people with new diagnosis of diabetes, but also those who have diabetes, which in many patients was very well controlled. Suddenly they come into hospital with the COVID-19 infection. The diabetes control becomes extremely difficult, and actually some of them might even develop some complications from diabetes. People with diabetes, generally speaking, we know that they are at higher risk relatively compared to other people of developing COVID-19 and severe COVID-19 infections. But controlling the diabetes and making sure that when people develop the problem of the COVID-19, controlling the blood glucose is a key in preventing these complications. Not only this, but also diabetes management as well becomes challenging. People often come in with very high blood glucose levels. We noticed that the difficult to control of diabetes usually indicates severe disease of COVID-19. We think it's a correlation. It's just an indication that the person has contracted a severe form of COVID, which is reflected by difficulty controlling blood glucose values. So this is what I was talking about. If someone has diabetes, normally if they develop COVID, management of diabetes becomes a bit challenging. Okay. Now, what we also noticed is that people without a diagnosis of diabetes, the number of people coming into hospital with COVID-19 and suddenly they are found to have diabetes, the numbers has risen significantly. People started to look into the possible causes, and there are some suggestions and some causes that I'm going to go through in a second. Many people, especially those who has type 2 diabetes, many of those are undiagnosed. That's to say, someone might have an elevated blood glucose, but not to a level that causes symptoms or causes problems. And these people are not usually diagnosed until blood glucose goes very high. So someone might have diabetes, particularly type 2, not diagnosed because they don't have symptoms. Suddenly they contract COVID-19, they become unwell, metabolic storms, they come to hospital with a very high blood glucose. How do we know they had diabetes but undiagnosed? One of the tests we do is a glycated hemoglobin, which usually a blood test that indicates how high was the blood glucose in the system for the last 2 to 3 months, for example. So we find that these people might have had diabetes undiagnosed, and actually if they haven't contracted COVID-19, they might have not had a diagnosis for several months down the line. So someone didn't have a diagnosis of diabetes, but actually they had high glucose for some time. So this is one theory and one postulation. Many of those people, and actually who, when you look at them, you think, oh, they might have type 2 diabetes, but they present in this condition I explained earlier called ketoacidosis. This is not a typical presentation of type 2 diabetes. So we also now ask ourselves questions, why this is happening. So a couple of reasons. First, and this is a recent study that's been published, we now know that the virus can infect and replicate in the cells of the pancreas. The pancreatic cells has some receptors which the virus can use proteins to anchor in and then go inside the cells, which then means the virus can replicate inside the pancreas. It can cause damage to the pancreatic cells, and then eventually the insulin levels drop significantly, and these people present with high blood glucose. So even in those who had type 2 diabetes, we have been seeing this condition presenting more often than we normally see. Also, the pancreas cells, even the cells that are not infected with the COVID-19 virus, the pancreas cells suddenly become unable to make insulin. And this is in a context of two aspects. The first aspect is that when someone is very unwell with an acute illness, some of the body function, including the pancreas cells, just become stunned and not.
Have we lost Dr. Bakhit?
I think I was muted.
Yeah, momentarily.
As I was saying, the body cells, generally speaking, especially the pancreas cells, in the context of an acute illness, might stop working. But also, we know that when the blood glucose starts going up in someone with diabetes, if the blood sugar is persistently very high in 20s or even in 30s, this high blood glucose overwhelms the pancreas cells and they just temporarily stop working. With improvement of the acute illness, things then eventually get better and the pancreas cells function usually improves. Many of those people who present with a type 1 diabetes picture in this context, they don't have actually antibodies. We know in type 1 diabetes, antibodies are usually the key diagnostic test. These people present and behave like type 1 diabetes, but actually they don't have the usual pathology. And by knowing more about how the virus can infect and infiltrate the cells, we now have more understanding about the process. Okay. An important reason is, particularly on the second wave of the pandemic, we have more growing evidence to suggest that steroids, and particularly dexamethasone, is one of the key therapies that reduces the severity of the disease and the mortality. And actually, we have been using such high doses of steroids. Now, what do these medications do? They inhibit the inflammation that is a result from the COVID-19 virus, which means they inhibit or they reduce the severity of the infection. What they also do, we know steroids, if someone with diabetes receives steroids for any reason, the control of blood glucose becomes challenging. These medications increase the insulin resistance. They work on moving blood glucose from the liver and from the muscle tissue into the circulation. So the control of diabetes becomes problematic. Also, even if someone doesn't have diabetes, using dexamethasone in high doses, blood glucose might rise. And that can be temporary. In many patients, this is a temporary, we call it steroids-induced diabetes, which is diabetes that's caused by steroids, by medications. Many patients then, after we stop these steroids, go back to normal and diabetes disappear. But we have to be vigilant and cautious because this gives us a hint that this person is at risk of developing diabetes in the future. So we have to be cautious about following up these people. Some of these patients actually don't recover fully and they might need some sort of therapy in the long term. So this is a quick review on why do we think COVID-19 may cause more patients with more cases of diabetes, and just an overview about the link between diabetes and COVID-19. Thank you very much.